again? I know I just did it. I just gotta look again. All right, and your date of birth?
January 28th, 19XX.
Perfect, and just your first and last name again?
Anna Perry.
Perfect, okay. Is it all right if I raise the head of your bed up?
Yep.
All right. Okay. Okay, I'm just gonna take your bed rails down. Alrighty. Okay, and I'm just gonna take a good look at your IV site. So I'm noting for any redness, swelling, bruising. I would eventually touch it once I performed hand hygiene. And Anna, are you experiencing any pain with your IV?
No, not right now.
Okay, sounds good. So I'm gonna go ahead and perform hand hygiene. So I would be doing this in the nails and around the wrists. And I would be taking my gloves. Right, and now that I can go in and feel around for any blood clots or anything like that, or any really inflammation, and I find that it's all good. So making sure I'm not turning my back from the patient, I'm going in with some alcohol swabs. I'm gonna take it out here, throw that away, and I'm gonna be taking this with this one. I'll be cleaning one of the ports for 15 seconds. So just watching the clock. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. So I know that port is cleaned. I'm going ahead with another alcohol swab, and I'll be cleaning the other port for another 15 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So now I know that they're dry. I'm making sure to not touch either of the end of the ports, and I see that the clock is at the 10 mark, so I'm just gonna wait 30 seconds until I go in and I complete the rest of it. So while I'm waiting, I'll be taking my solution, saline solution, and I'll just be breaking the seal a little bit there, and then getting out any extra fluid, or water, sorry. All right. Okay, and it's been 30 seconds. So now I can take off my white cap here, and I'm going in, not touching the ports. I'm gonna put it on this one first. All right, so in my text, it is best practice to give 2 to 3 milliliters of fluid. So I'm gonna be unclamping my little guy here, giving in 2 millimeters of fluid and clamping right at that 2 millimeter mark. Yep, and then I'll be taking it off, and I'm gonna flush the other side as well, not touching those end ports there. Knowing that the top of this is sterile, so I didn't have to clean this guy here. So unclamping this one again. I'm going in, and I'm going to give 2 milliliters more up fluid through this port, clamping right when it gets to that middle port, that 2 milliliter mark. And again, I would clamp this and then discard with it in my gloves, but I'll be saving that for later, and then I would be performing hand hygiene again. All right, Anna, are you okay?
Yeah.
Everything went well? No more pain or anything?
Nope.
Okay, sounds good. I'm just gonna put your bed rails up. And I'll be walking around the other side to look at your drain if that's okay.
Yep.
Okay, sounds good. All right, so I'm gonna just be looking at your drainage. Can I lift this up?
Yep.
Okay, I'm just gonna take this down if that's okay.
No problem.
Okay, and it's best practice to do hand hygiene again. And so I would be doing hand hygiene again and putting on gloves just because we are going to be assessing a drain and there is bodily fluids there. So just putting on my gloves again, making sure I'm not having my back to the patient. All right. So, sorry. Ignore that. All right, so I'll be looking for, I'm just going to lift this up, okay, Anna?
Yeah.
All right, so I'm looking for any bleeding, bruisings, knots or kinks in the area. I'm going to be looking for if it's lower than the insertion site, which it is, what kind of fluid that is in it. It looks like serosanguinous fluid, kind of bright reddish. It's not purulent, so I'm not worried about infection at all. And it also is squeezed, so we know that it is draining properly because of the negative pressure that's inside of the Jackson Pratt drain. So we know that it's going to be sucking out fluid. All right, Anna. I do have some patient teachings with you because I know I just did give you some antibiotic medication, and I just wanted to go over some effects of that. First of all, I'm going to just take my gloves off again because I didn't actually really need them there. So then I would discard them and perform hand hygiene again. All right, so I wanted to go over some teachings with the antibiotic that I gave you. So with the antibiotic, you are going to be, if there is any signs of abnormal bleeding, so say if you're brushing your teeth and you find yourself bleeding and excessively, like a lot, please alert us. Or if you're starting to find random bruising anywhere. Another one is also watching out for anaphylactic reactions. So like we did do teachings over this, we're going to be looking for swelling, hives, itchiness, trouble breathing. Just hit that call bell and alert us. And another patient teaching is the antibiotic can produce diarrhea. So just letting you know if you are experiencing diarrhea to again let your nurse or physician know. Okay. So again, not touching my back from that. So now I'm just going to do some teaching of the incentive spirometer. It's over this way. Thank you to my assistant. So this is an incentive spirometer. Are you aware of what this is?
I'm aware, but I just can't remember.
Okay, how about we do some patient teachings with you then?
Sure.
So I'm going to get you to sit up as high as you can in the bed. So I'm just going to raise you up. And just let me know when high enough is if you're feeling uncomfortable at all. Is that about good there?
Yep.
Okay. Sounds good. Okay, I'm not turning my away from the patient. So I'm just going to get you to hold this. Thank you. So in an upright position, I'm going to get you to hold it and put this bottom mouthpiece here in your mouth and wrap your lips and seal it tightly. And then after that, I will get you to breathe slowly and deeply as possible. So what you're going to do is you're going to exhale and then, exhale and then breathe in as much as you can until this little yellow ball is reached the smiley face. I'm going to get you to hold that breath and try to keep that ball in the smiley face for as long as you can, preferably 3 to 5 seconds, and then slowly exhale. And then we're going to rest and repeat that 10 times, and we're going to be doing that every hour. Okay. You understand?
Yep.
Perfect. Okay. All right. So then I'm just going to go through some breathing and coughing techniques for you, and this will help really clear out your lungs and start strengthening your lungs again too as well. So what we're going to do is we're going to breathe through our nose very slowly, and we're going to hold that for 3 to 5 seconds or as long as you can, and then we're going to exhale out of your mouth nice and slowly. And we're going to do that 3 to 4 times, and after every breath, we're going to cough a little bit to ensure your lungs are clear. Okay. And if you do have any secretions come up while you're coughing, I'll have a box of tissues beside you and just spit it out. Don't keep swallowing it down. It's best to get all that secretions out of your mouth. Okay, and then last but not least, I'm going to go through some foot exercises with you. Would you like to go down a little bit for the foot exercises, or are you okay?
I'm okay like this.
Okay, sounds good. So I'm just going to put your bed rails up, or would you like it up or down?
It's fine either way.
Okay, sounds good. All right. So with your foot circles, with your leg here, we're going to take your big toe and you're going to draw an imaginary circle with your big toe. Awesome. That's great. And then another great exercise to do is flex your foot all the way backwards, trying to touch your toes to your shin. Good. And then another one is alternating back to pointing your toes like a pretty ballerina. So we're going to do the foot circle one 5 times in a row, and then we're going to do the alternating back and forth for another 5 times in a row. Perfect. Do you have any more questions, Anna?
No.
Sounds good. I'm just going to lower your bed if that's all right.
Yep.
All right. All right, and you're fine sitting up, or would you like to go back a little bit more?
I'm okay like this, thanks.
Okay. Well, you ring the call bell if you need any more or anything, and I will be right here to help you.
Perfect, thank
Okay.
you.
Bye-bye.